My name is Jack Hahn. I'm going to give a brief introductory on diseases and a few things that kind of encompass disease, some different categories of diseases. So a disease is anything that disrupts homeostasis. It can be a acute or a chronic disease. An example of an acute disease would be strep throat, is one that everyone knows, which is caused by Streptococcus, so it's a bacterial disease. So some different disease classifications can be either congenital diseases, so some that are acquired before birth. Those can be acquired from the pregnant mothers, so like maternal viruses or maternal diseases. Another type is acquired diseases, which can occur after birth, which would strep throat would fall into that disease category. The etiology of diseases is the cause or the agent that causes the disease. So you can have bacterial agents, again, which would be the running example with strep throat. You could have chemical agents, so anything like alcohol or drugs. You could have physical, so trauma or burns. Some genetic mutations can give rise to different diseases. And nutritional deficits can compromise the immune system's ability to combat diseases, so that plays a role as well. So those are kind of the different etiological factors when disease manifests itself. The next kind of category is pathogenesis, which is the window of everything that occurs after the initial infection. So for the strep throat example, it could be, those cells in the throat initially get infected with the Streptococcus, and then on day one, you could experience maybe some tenderness or swelling. On day two, headache and fever, things of that nature. So pathogenesis is basically the window of events after the initial infection takes place. The next category that kind of builds into that is symptoms and signs. So symptoms are anything that are subjective. So if I went to my provider and say, hey, my throat feels tender, I have a headache, those are things that they cannot measure or quantify. So those are symptoms because they're coming from me, the patient. Other things such as signs are things that can be measured, such as if I'm febrile and I have a 100-degree plus fever, or if I have rhinorrhea, or if my tonsils are swollen on exam. Those are signs because they can be measured by my provider. And then those two things combined is the syndrome. So a syndrome is both the umbrella over signs and symptoms. So the syndrome is all characteristics of a specific disease state. So for strep throat, it could be, headache, sore throat, difficulty swallowing, rhinorrhea, febrile, amongst other things, aches or myalgias. That's the syndrome of that specific disease. A diagnosis is basically the cause of a disease, and there's a few different things that come into effect with a diagnosis. Past medical history. Do I often get strep throat in the past? Have I had a tonsillectomy in the past? My history of present illness plays a role. That develops the timeline when I'm talking to the provider. I started feeling bad 2 days ago. My sick context, so social history. Is anyone at work or sick? Is anyone at work or school sick currently? Do they have similar symptoms? And then, of course, the physical exam. When they do a physical exam, are my tonsils swollen? Diagnostic studies. Do I have a fever? Things of that nature. Do I have a positive bacterial culture? So all of that information lumped together supports or leads in a specific direction to make a diagnosis. Complications of a disease. So a complication can arise, or it's any adverse event after treatment begins. So for the strep throat example, a lot of times people will discontinue their antibiotics early because they therapeutically feel better. So they may stop on day 7 where they have a 10 or 12 or 14-day course. That, of course, there still can be some Streptococcus cells present that then can proliferate since they haven't been destroyed, causing a rebound infection. so to speak. So that's one specific complication. Another would be, if a lot of times now bacteria can be penicillin resistant. So if your provider gets the wrong antibiotic for a specific strain of bacterial infection, that can be a complication because it won't be as effective, and then they'll have to switch antibiotics. So that's another possible complication. The prognosis is basically once you begin treatment, it's kind of the window of expected events, if you will, after the treatment begins. So on day 5, I may start to feel better with my antibiotics on strep. Day 10, I may expect to be symptom-free. Another term is for cancer. A lot of people know the term prognosis, so it can be expected lifespan after diagnosis in certain more serious cases of cancer, or it can also include, on week 4 we're going to begin radiation, week 8 we're going to begin chemotherapy, and those aren't real examples, but it's basically a sense of when you're going to start certain treatment options and what to expect with those treatment options, and kind of the timeline of the illness or disease, if you will. So that's the prognosis. And then diagnostic studies basically allow us to visualize and gain more specific information regarding disease states. So things like CT scan, PET scan, MRI, X-ray will give us visual information. And then things like blood tests, urine tests, biopsies, and cultures will give us specific information about either blood markers or urine levels, and then with biopsies and cultures, some specific information regarding the tissue or bacteria strains. So that's kind of a brief overview of diseases and a few things that play into either diagnosing diseases or categories of diseases. And yeah, I appreciate your time. Thank you.